Coronaviruses are generally thought to be spread from person to person through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can get into the mouths and noses of people nearby, within about 6 feet, or possibly inhaled into the lungs. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. Recently, there has been a surge in people buying masks as a form of protection. Well, the United States top doctor has one simple request: stop buying face masks. U.S. Surgeon General Dr. Jerome Adams posted on social media, they are not effective in preventing general public from catching coronavirus. But if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. Washing your hands, staying home when sick, and other everyday preventative actions are the best protections. Social distancing is a public health intervention in which people are encouraged to keep physical distance from others in order to slow the spread of illness. According to the CDC, social distancing means remaining out of congregate settings, avoiding mass gatherings, and maintaining distance approximately 6 to 10 feet from others when possible. That is why some of us are working from home this week.
To make sure this morning, we actually had the measuring tape out here on the desk.
To make sure that we were 6 feet apart, yeah.
So this is a little bit longer of an explanation, so bear with me. According to the CDC, coronaviruses are a large family of viruses. Some cause illness in people and others cause illness in certain types of animals. Coronaviruses that infect animals can become able to infect people, but this is rare. We do not know the exact source of the current outbreak of COVID-19. The CDC also says that they do not have evidence that companion animals, including pets, can spread COVID-19. Now, they also go on to say that there is no evidence to suggest that animals or animal products imported from China pose a risk for spreading the 2019 novel coronavirus in the US. Now, they do recommend, though, if you are sick with COVID-19, you should restrict contact with pets and other animals just like you would other people. Now, although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people sick with it limit contact with animals until more information is known about the virus. So if you're feeling sick, you are urged to stay home and recuperate. Most people will only have mild symptoms and will recover within a few weeks. Now, if you experience shortness of breath or chest pain, call your healthcare provider and he or she will advise you what to do next. If you don't have a doctor, you can call ahead to an urgent care clinic. Those without medical insurance should call a federally qualified health center, including CommuniCare, Central Med, and University Health System clinics. It is important to note that officials do not want people to go to the ER. Testing for COVID-19 is done through a doctor's office, not at Metro Health. Now, hospitals and first responders have implemented new protocols to try to protect workers from the new virus. Under the new protocol, only 1 or 2 paramedics may respond to your call. They will stay 6 to 8 feet away and ask you some questions before treating you, and they may ask you to call your healthcare provider if it's not an emergency. Only true emergency cases will be transported to the hospitals. The San Antonio Metropolitan Health District has opened a hotline for Bexar County residents with questions about the novel coronavirus. Residents can call 210-207-5779 during weekdays from 8 a.m. to 5 p.m. The COVID-19 hotline is available in English and Spanish. The United Way helpline will guide people with questions about local health services. That number is 211. For more questions that you want answered, head to KSAT.com and submit them in our SAQ article.